Dave, how are you?
Doing well, thanks.
Good. Just doing a couple more minutes for people to join.
Morning, Dave. It's Reiner Lowe's panel. Can you hear me?
Yeah, we can hear you, Raina.
You can or cannot?
We can.
Okay. So I'm on my computer, but I don't have the Microsoft browser for some reason. And I can't seem to. Is there a live video yet?
Yep, you should be seeing a screen that's got the little care bot on it.
Thereabout.
Yeah, it's got,
Like a guy with a.
yep, with his fingers up,
Yes,
physician engagement sessions.
One record, 140 login sort of thing.
Care bot
Do I have to do anything more now?
Nope, you're all good.
No. Okay. Okay.
Care bot on it. Okay, group, it is 4 o'clock, and in the name of keeping in time and respecting everybody's time, we'll get started. So I'm going to hand over to Dr. James Lane to do a little bit of introduction. And James, you just let me know when you want me to hit the next screen, although this one's pretty intuitive, and I'm on it.
Good. Thanks, Karen. Welcome, everybody, to the third installment. I kind of feel like we're the last talk at a 3-day conference, and everybody's kind of wanting to get home. But, we got a good representation of people from across the sites, it looks like, on the call. So introductions. My name is James Lane. I'm the CMIO at Collingwood. Also on your screen are the other reps from the other 3 hospitals. Dr. David Bayfield is the CMIO at Georgian Bay. Dr. Sanjeev Singhvi is the CMIO at Headwaters. And Dr. George Karasmanis is the CMIO at RVH. Karen, who you heard briefly at the beginning, is the CARE4 clinical stream lead. She keeps us all in check. Next slide, please. So today is just a brief introduction to MEDITECH. We're actually using a live test version of MEDITECH. It's our build. It's not at its final version, so there's still some functionality that's not embedded in the system, but for the most part it's going to see when we go live. And today's presentation is meant to be a high-level introduction of what the system looks like, how to navigate through the system. It's going to cover physician documentation, including the use of Dragon and Dragon Medical One. And it's going to demonstrate the functionality in physician order sets that many of the champions have been working on over the past several months. This is meant to be an introduction, and more detailed education will follow. And some of the key dates are in the blue bullet. Online education is going to be available at the end of May, and end-user training will occur over the 2 months of the summer, July through to the beginning of September, with the go-live set for September 18th. Next slide, please. So today's session is broken out into 2 parts. For the general session, it will be 90 minutes, and all participants will be invited to watch and interact. We have a chat version, and you're more than welcome to pose questions in the chat, and we'll break at appropriate times and answer the questions. The second part follows that, and it's designed for the physician clinical champions. We have 66 of those spread throughout the 4 hospitals. And we have sessions that are broken out into 3 areas for the appropriate clinical area that you work in. So the emergency department, surgical department, which can include the anesthetists, and hospital medicine flows. And you'll be directed how to log into those breakout sessions at the end of the general session. Next slide, please. So we'll leave it for the team to take it away and give us a demonstration.
Perfect. And I think we're handing over to James Castillo.
Perfect. Good afternoon, everyone. My name is James Castillo. I'm a registered nurse by background and a consultant with Health Tech Consultants. As Karen said, if there's any questions throughout this demonstration, feel free to put those in the chat and we'll respond appropriately when there's time, kind of as we're doing that demo. What you're going to see today, and I haven't started sharing my screen yet, you're going to see a demo of MEDITECH Expanse as it is today, and there's going to be a lot of information covered. Know that this is the first of many steps or multiple steps in terms of your learning journey as physicians, and there will be more added just so that you don't feel overwhelmed today, because we want to make sure that you do have enough information going forward. So with that, I'm going to actually share my screen and get into the system.
James, it's Karen. I will monitor the chat for you.
Thank you, Karen. Can I just get a quick confirmation we can see my screen, and then I'll go ahead and start?
Yep.
Perfect. So after you get logged into the system, this will kind of be one of your landing screens that you'll see once you're kind of settled here. And once you do get here, there's three kind of buttons that you're going to be oriented to. And the first three buttons that we are concerned with the most are the Web Acute Status Board, the Web ED Tracker, and the Web Ambulatory Home Screen. Now, depending on what you're working, whether it's the inpatient side of the house, the ED, or the ambulatory side of the house, you're going to choose the appropriate application. Note that all of the functionality kind of between these three modules is very similar and very much the same. A lot of what we're going to be covering today, or what we are covering today, is actually going to be the Web Acute Status Board. Again, the functionality between the modules will be the same, but as you get more education, you'll actually get the training within your specific module. So for me to launch into the first screen that we'll be doing a demo in today will be the Web Acute Status Board, so I'm just going to go ahead and click into that. So now I've launched into the Web Acute Status Board, and there's a lot of different information that you're seeing here. I'm just going to take a few moments to make sure to navigate you to the screens that you're seeing and all the information that is available to you. Now, before I start, there is the option for me as the user to basically scroll up and kind of scale the screen as I would like to, so that I can see the amount of information, or depending on how large my screen is or whatever my resolution is. So that can help in terms of being able to view all the information. So for this session, I'll try to scroll up as much as possible, because I don't know what kind of screens you're all watching this demonstration on. Now, before we get into all the meat and potatoes down below in the screen that I'm circling, I'm just going to draw your attention to the top navigation bar. Now, on the top navigation bar, you can see that we have this Return To button in the top left. This Return To button basically works like opening a tab in Google Chrome. All the other application, or I guess windows within MEDITECH, are kind of opened in the background. And let's say I wanted to switch back to that main menu, I'd be able to flip back and forth by using that Return To button. I'm going to go back into my Web Acute Status Board here. To the right of that, we have the clinical home screen, or the home button, sorry. And in that home button, we can basically return to this screen whenever we're in a patient's chart. So this black navigation bar, including this home button, stays with you regardless whether you're in one patient's chart, moving to another patient's chart. So it's kind of like that safety net, if you will, in terms of being able to navigate to where you want to in the application. To the right of that, we have the chart button, and if I potentially had one of these patients selected, you can see that it's highlighted in green, I could be able to navigate to that patient's chart. To the right of that, I have the document button. Again, if my patient were selected, I could navigate to that patient's documentation section, or if I wanted to create a document. And to the right of that, if I wanted to order on that patient or access that patient's discharge summary. Now, I'm just going to move this little application that I have floating around here, because this will be covered in the documentation section, but this is actually drag in, and it allows us to dictate directly into the system. Now, moving to the right of that, we have our sign queue. And our sign queue, I'm just going to go ahead and click that. These are all the items that I have left outstanding to sign. So if I have any documentation that I've potentially started on another patient but haven't signed off yet, it's accessible through this sign list. Also, you'll have things that, maybe orders that nurses entered on behalf of you, such as a telephone order or a verbal order, only in the correct clinical circumstances. Those orders would populate into your sign list, and it would be our responsibility to go and sign those off at some point. I'm going to click that home button to get back and out of the sign queue. Now, to the right of that, we have our workload button, and I'm going to just go ahead and click into that workload button. And your workload button kind of works somewhat like an email address within the system. But if there are, system-generated tasks, such as a consult, for example, so let's say a physician requested a consult to you, you'd be able to go to your workload, and that would be able to be seen by yourself. It doesn't replace the telephone communication that you would have with the physician, but it's also a nice little reminder for yourself to be able to see that, oh, I do have that consult that I need to fill. Again, I'm going to go back to my home screen by clicking that home button. Now, to the right of that workload button, we have the menu screen, or menu button, sorry. And in here, we can set some preferences, and a lot of that will be covered in depth in your training. And then to the right of that, we have another settings button over here. And then to the very right of that, we have our close button. And that basically closes out your session. So that is the top navigation bar. And now we'll get into some of the content and functionality kind of sitting below that navigation bar. So you can see that the account that I'm logged into, so if I were in my actual account, this is a test account, it would say my name, so it would say James Castillo, but I'm using a test account. So you'll always know that this is your session over here. Down below that, we have our rounds list. And basically, this is showing me all the different patients that I'm tagged as MRP, as well as any active patients that I'm actively consulting on the inpatient side of the house. With these patient lists, you can actually switch out and kind of use them like a filter to look at the patients that you're interested in seeing. So whether I wanted to look at all the patients that I've recently discharged, I could go into the discharged patient list. If I wanted to look at my surgical cases or my upcoming surgical cases, I'd be able to click that surgical cases button. Or another thing, I could also look at my consultations. Again, these lists will be reviewed during your training when you do receive that. Now, there is also, I do want to cover one more list. There is also a My All Patients list, so you can actually create and customize your own list outside of these system-generated lists, if that makes sense as well. And in our other sessions, we did have some questions. Well, how do I see another provider's patients? Or what if I'm trying to cover for a bunch of people? Well, another button that's available beside the rounds patients list is this little button beside it with two people. And if I wanted to edit this coverage, I'm basically able to see the patients that I would be, that another provider was caring for. For example, Dr. Lane, I know we had Dr. Lane on the call, so if I wanted to look for Dr. Lane, I'll be able to search for him. And basically, that's going to allow me to look at all the patients that Dr. Lane has under his care. And you'll see that my number of patients changed from like 95 to 103. Note, this is a test account, so 103 patients is a significant number of patients. So hopefully in the real world, we're not actually caring for 103 patients with MRP. Below that now, we're going to get into this status board over here. And what we can see is that there's various pieces of information about the patient that's kind of pulled forward so that you can see it without actually having to go into the patient's chart. So this is kind of like that view that allows you to take your step back and really look at all the information about all the patients that are under your care or consulting on, for example. So you can see that my patient's name is in the top left-hand corner, and it's in yellow because we have patients with a similar name actually under our care in this list. Now below that, we have the patient's age and sex, their location, and I'll just highlight a few more pieces of information because I'm not going to go through every single one, but we can see the patient's reason for visit. So this patient has the reason for visit of abdominal pain, and this patient is actually, their MRP is Dr. Lane. There's multiple Jameses on this project. Now, moving to the right of that, there's going to be a whole bunch of information here, but I want to point your attention to this sticky note kind of functionality. And it's resemblant of a sticky note because that's exactly what it is. It's a way for you to be able to put information kind of as a personal reminder for yourself. And since this list is going to follow you as the MRP or anyone that you're consulting on, you can see this information within this sticky note. So for example, I can see that in this sticky note, someone put, or I put, reminder to review patient's vitals tomorrow. This is only for yourself, and it's actually not stored as part of the patient's permanent record. It's really for communication purposes only. So that is our patient's list over here. And, well, I'll highlight one more thing. We also have the activity tab. And on the right, in this activity tab, we can see that there's information, lab, imaging, any notes. And basically, if there's anything highlighted in bold or anything in red, it means it's a new result or new something that we can check. And we actually don't need to go into the patient's chart to be able to view that. We can do that simply by clicking this button. And if I click that button, for example, there's all these pieces of documentation that are attached to the patient or any results potentially from lab or imaging, and I could review that directly from the screen. So let's say it looks like this patient had an anesthesia consult. I could simply pull up this information just by looking. I'll just look at this respirology consult. And this patient is a confidential patient. That's why this patient had that pop up. But I can look at this note without actually having to go into the patient's full chart. Now, before I go into the actual chart of a patient, do I have any questions in the chat, Karen?
Sorry, just had myself on mute. I am not seeing any.
Perfect. So I'm going to go ahead and launch into a patient's chart. But before I do that, if I wanted to launch into the chart of one of my patients here, I'd simply click on their name, or I could highlight one of the patients and click the chart. However, we've actually prepared a specific patient for this demo, and I'm just going to actually use the search button to launch into that chart.
Before you launch, James, the question is, what are the other columns? And a question around call groups.
Sure. So the other columns, again, more of this will be covered in training, but there's a piece of, and we're probably going to have to cover it later today with our suggestion orders, but we can see whether there's orders in what's called a hold queue. To the right of this hold queue, we also have a list of all the physicians that have been associated with this patient's care. And again, I can expand that and look at that detail within the patient's chart. And to the right of that, I also have patient problems, for example, which we'll be covering shortly as soon as I get into the patient's chart. And call groups.
Yeah, call groups.
And so if I look at my coverage, if we look at edit coverage, one of the things that we can do is we can actually look at the patients under a specific physician, but there's also something called provider teams. So, and again, that's something that we're still actively working and pursuing in terms of build, but we could actually create a provider team. Like, and I don't know if this would make sense for anyone at your site, but if there was like a medicine team A or something like that, you would be able to choose that call group or team, how we call it in MEDITECH, and then you could see all those patients tied to that group. Anything else there, Karen?
Yes. Okay. Who populates the pending consults? Do others have the ability to populate this for the consultant, pardon me, or do we do it ourselves as the consultant?
So the way consulting, the consultant workflow in the system, it's actually order driven. And Heather, I think, or the order set team when we come on later, they'll be explaining it, but you'll basically order a consult in the system. You have to specify who the provider is, and that actually goes into their workload. And, you know, there still needs to be a telephone conversation to facilitate that consult, but it'll be seen in the system. So it's both a mix of user and system-driven, I guess, flags or notifications.
Okay. You also have regarding new labs. Is there a more obvious indicator of new results?
So if there actually was like something critical or something high, it would actually show up in a different color over here.
Okay.
Yeah. And it makes more sense once you get into the patient's chart as well.
Okay. And how do residents or learners access?
So residents and learners will also have access to the same screens that you're looking at. And when we're building out our functionality, and this is something that a different team other than the physicians team, systems team, we're helping inform that build. But we can basically lock down, this is what you see and this is what you can do. So we have basic different settings based on the profile that that person has to control what they do or don't do in the system.
Okay. Next question is, are my sticky notes visible to everyone or just me?
Your sticky notes are only visible to you, but there is functionality that we can use once we're in the patient's chart to facilitate communication electronically within the chart. That doesn't replace the actual verbal conversations that we still need to have as care providers.
How to access verbal orders?
So verbal orders are actually something that, so are we talking about like another care, like a non-physician or non-provider ordering that on behalf of? So that's
Sure.
something that those nurses or allied health members, depending on the workflow, they would be able to actually enter a verbal or a telephone order in the appropriate clinical circumstance. But what that actually does, it becomes active in the system when that nurse or allied health enters it, but it also goes back to your sign queue for you to go and review and sign off to make sure it was exactly what you had stated as a physician or provider.
Awesome. A few more questions. Can you remove yourself from the physician list of involved docs? Sometimes we are entered incorrectly.
Yes, you can actually manipulate that. And there is functionality, and again, that will be covered in your training, but you can update that.
Okay. And then I think you covered medical learners. Can medical learners write orders? What is the process with a resident? And what is the process with a medical student, PA student?
Yeah, so that's all settings. That's all set up at their account level. So basically, whatever they're either doing today, or if there's been any new discussions about the roles and how it will be impacted by the system, it will reflect that. But it can all be set up at the account level. So basically, me as James Castillo, if you wanted me to say I can't order anything anymore, then I'd be set up in the system so that I couldn't be able to order anything.
And you are all caught up, James.
Thank you. So I'm going to go ahead and launch into the patient's chart. Again, I could just quickly click their name here, or if they're highlighted, I click the chart button. But I'm going to search for a specific patient just because I know that we prepared this patient for this demo. And I searched by last name, comma, first name. There's other ways that you can search in here, but I'm just going to go ahead. And to launch into this patient's chart, I can just click on their name. Now, again, we're inside the guts of the patient's record now. We call it within MEDITECH the electronic medical record. And there's a file folder structure at the top, and then there's something called the reference panel all the way on the right-hand side here. We're going to start and break down the information on the right-hand side over here before we get into anything on the left. But I just want you to note that, look, the black navigation bar is still available for you. So again, it kind of follows you everywhere you go whenever you're within MEDITECH. So the patient's last name, first name, age, sex, date of birth, health card number is all listed here. This patient doesn't have a health card number. Below that, we can see that the patient's location is here, and their registration status within MEDITECH right now is admit inpatient. So this is currently an inpatient within the system. Below that, we have the height and weight of the patient, the body surface area, and the BMI, which automatically calculated from this data point over here is all available. You can see their account number, and then to the right of that, you can see their resuscitation status. Right now, this patient is in a limited resuscitation status. There's currently full, limited, and do not resuscitate, but the order set team member will actually be going through that when they go through their portion of this demo. So below this patient header area, we have the search chart functionality. So all the information in this chart is contained within these tabs, but if I just wanted to be able to search something like I would in Google, I can actually use this search functionality. So let's say I wanted to search for a CBC. I could go over to the diagnostics tab in the very top left, but I'm just going to search for it via the search routine so I can show you what that looks like. By clicking on that, you can see that it returned a bunch of different results for that CBC. And that was really handy for me because I could quickly find that information here. You can see that anything that's abnormal is highlighted in yellow with an H denoting high or L denoting low, and if anything is absolutely critical, it will show up in red.
So James, you have a question in the chat. Why would we want the account number? Perhaps it's clutter.
So the account number, again, that's standard functionality within MEDITECH, so we can't turn that off, but that actually is quite important to us because we want to see which visit that patient is on. Again, when you search for your patient, it'll always pull up the active account first and foremost. But in current MEDITECH, it's actually something that's already embedded within the function, like it's already embedded in the patient header, and it's not something we turn off or can turn off. Another question, Karen? I think you're on mute.
I am talking away and unmute. MEDITECH specialist Eric is also contributing. Is also a button that shows all accounts that the patient has had. So that's also to indicate, and that is the end of the questions in the chat.
Perfect. Now, below the kind of the patient header, we have the reference panel region over here. And basically, each of these buttons that you see here is what's called a widget. And the widgets are pieces of information that are basically pulled forward from all the different areas of the chart. And whenever you're in the chart, this area on the right kind of stays with you. So you'll note that if I bounce between the summary, the activity tab, or all these different tabs, the information on the right here stays static. So these are pre-defaulted in terms of what information is actually going to be pulled forward. But the information that you can choose to customize this as a user. So all these different widgets and what you're able to choose to come forward is absolutely customizable by you as the caring provider. So below that, we have allergies, we have patient problems. So patient problems are things that we can populate, and they actually carry over from visit to visit if they're not reconciled or if they are reconciled. And they're good at denoting issues or problems that the patient has, and it can quickly be seen right from this panel area. Below that, we have our home meds, so we can quickly see all the different patient home meds that the patient's on. So right now they're on some Tylenol, some metformin, and a statin. Below that, we have past family and social history. So this isn't something that physicians are primarily responsible for, but they would be able to actively see any documentation from the nursing side if they were to have populated anything in here. If physicians wanted to as well, they'd be able to actually document some of this information by launching this widget. And you can also create your own widget that actually pulls forward data, and that's something you can choose to customize as a user. So that's the right side or the reference panel area. Moving to the left, we are going to get into the different chart tabs. Now, the first one that you're always going to kind of land on is the summary screen. And the summary tab really is just that. It's really a summary of all the data points or the widgets, again, that you've been, that are pulling forward for you. And again, this is completely customizable, but we do set defaults at the start, but it could be customized based on your preferences. So we have things like the bulletin board, and this, like the sticky note that we had on the status board before, we can actually use this to facilitate some communication. Right now, we're thinking it's between providers, but that could be updated in the future. Down below that, we have special indicators, so we can see whether the patient falls risk, if they have any hearing or any vision issues, as well as the vital signs that this nurse might have, the nurse caring for this patient would have documented. So if I launch that vital signs button, I can quickly see all the information that she documented, and it looks like everything's within normal range. Below that, we can even pull forward our lab results, as well as any diagnostic reports from microbiology, or even our DI reports, like a chest x-ray report. So if I quickly click this icon, I can actually launch the report about that chest x-ray. And one of the things that will also be available is actually the image associated with this. It will be available within MEDITECH as well. And to the right, so your summary screen is broken up into 2 columns, and you can choose which widgets you want between the 2 columns. But for now, that's basically the summary of the Summary tab. Moving to the right of the Summary tab, you have the Activity screen. Do I have a question, Karen? I heard your voice.
You sure do.
Yeah.
You heard me on mute.
Yeah.
How can you tell what is clickable with this interface?
Yeah. So anything that's highlighted with like a blue dither or like a hyperlink is editable. So this bulletin board is in blue, and it might depend on the screen that you're currently looking on right now, but I can see that it's clearly marked in blue with an underline, and so that's something that I can actually click within. As well as the different widget headers on the right side of the reference panel. Let's say the allergies. These are also, it has an underline here. If I click on that, it launches a different kind of overlay. Is that it, Karen?
That's it. You're up to date.
Okay.
Oh, I lied. Is there any way to see vital signs in a more visible format where we don't have to scroll down?
Yeah, so we can actually look in, well, if we open up the vital signs widget, it actually opens up the entire overlay, which is a bit more of a chart view, but there are different views like a flow sheet view, or even if you wanted to look at them in a graph, there's multiple ways for you to be able to look at this information.
I'm tempting the fates, and I'm going to say you're caught up. And Eric is also saying, oftentimes the cursor will change to a finger when clickable items exist as well. Yeah.
Thank you, Eric. Now to the right of the Summary tab, we have the Activity tab, and the Activity tab is basically a nice chronological overview of everything that's happened to your patient. So whether it was you or another physician or nursing or allied health, you can kind of see all the different documentation or anything that's been resulted on your patient in this view and the date, corresponding date and time. So for example, it looks like there was a respirology consult on the 23rd at 7:15, actually when we were doing this demo yesterday, so you can kind of see that. So it's a good summary in terms of activity, and it chronologically organizes it so that you can quickly hop over to this tab and see that information. To the right of that, we also have flow sheets. So flow sheets, kind of like if I were to pull up that kind of summary or the vital signs from before, flow sheets allows you to view different information in different formats as well. So right now you're looking at a generic kind of flow sheet that we have. You can actually create your own flow sheet or look at any of the pre-defaulted ones over here, and that'll actually pull information forward. And spending the time to, and this will be something that we'll be doing before go live, setting up those defaults, setting up those favorites in terms of what you want, what data you want to see in the system, will go a long way in facilitating ease of use for yourself.
So you have a question. Activity is MD plus allied health.
Thank you. So I'm not going to go through each of the tabs because they'll be covered more comprehensively in your training, but I'll just highlight a few more. So we'll go through the history and problems. So if there's any history, the patient's history, if there were anything documented, again, on the nursing or allied health side, it would be available here. None has been documented. But you can also see the active problems on this patient. So this patient currently has COPD, hypertension, and diabetes. Note that this information is the same information that we have on the right side of the panel. So there's multiple ways to view a lot of the same information within the patient's chart. To the right of that, we have our administrative tab, and if you can imagine, the administrative tab would house all the administrative data. So if there's any demographic information, I can collapse these ribbons. Insurance information, legal information, I'd be able to find that here. Again, remember in our summary tab, a lot of those demographics were actually pulled forward in this little widget. So that's the benefit of really customizing the summary tab. On the right of that, we have our other clinical tab, and our other clinical tab, as you would imagine, contains a lot of other clinical data, and it's organized by these headers. Again, allergies that we can see here, the data is the same between this allergies and the widget on the right-hand side. At the very top, we have our diagnostics, and this is one of the tabs that we'll be definitely going into quite a bit, especially when we're looking on those results based on our patient. And it's actually categorized by these different buckets. So if there's any lab results that have been returned, they're going to show up here. So you can see that this was our CBC from earlier. To the right of that, there's imaging stuff. So we can see that if there was that chest x-ray that I looked at earlier, to launch that report, I simply click on that icon. So on and so forth, but it's basically the same idea where, and these were order driven, so if the order for that was put into the system and a result came back, you'd be able to view that information through these different tabs.
James, you have a question. Do active problems get carried forward automatically from one visit to the next?
So at the point of discharge, and we're not going to be going into the discharge process today, that'll be something that's covered in formal training, there is a reconciliation process that happens, and only the problems, and after they've been reconciled, and the ones that remain active on the chart. So let's say we've said that this patient's COPD, hypertension, and diabetes hasn't resolved, as they're chronic issues. So at the point of discharge, we would likely keep them active, and then when they come in through emerge or get admitted, they'll actually still remain active on the patient's chart. Is there another one in there, Karen?
Nope, no further questions in the chat at the moment.
Okay, so then to the right of diagnostics, we have provider notes. So let's say there was any documentation that specifically, so providers within MEDITECH, so like physicians, nurse practitioners, for example, it would file under here, and you'd be able to see all those notes and their status. So right now it looks like I've canceled a couple notes because we did that just in testing. But if I wanted to look at the consult note, I can see that I can just launch that directly from clicking on that icon. Now to the right of that, we have our nursing and allied health tab, and anything that they document is available in the system. I mean, that's the reason why we're doing a lot of it. Like all the information for all of the clinical care providers is available to facilitate clinical decision making, and everyone gets that single source of truth in this record now. Now to the right of that, we have active medications on the patient. Looks like we have a few on here, but again, this will be covered in the order set section of this demo. So before I hand it off to Maria to get into what documentation looks like, are there any more questions?
I am not seeing any in the chat.
All right, so thank you, and I'll pass it off to Maria.
Hi everyone, my name is Maria Ma. I'm part of the clinical informatics team. I'm part of the CARE4. I co-lead with the physician system. I'm in charge of the PAPD side of the house. I've been at RVH for 15 years, 8 years at clinical informatics. So right now what I'm going to be demoing for you is the documentation side of the house. I'm just going to go here and share my screen. So currently right now, the screen that you're seeing at the moment is our rounds list, just what James has indicated. And what I'm going to do is I'm going to be searching for that patient that James was just using under the find patient here. You'll notice in here as I'm typing as well, I'm using uppercase and lowercase. It's not case sensitive. So I'm just going to hit enter here. And now I've located the patient, making sure that it's the correct MEDREC number, that this is the correct patient that I'm looking for. I'm going to pick the patient. From here, it opens our open chart where we were earlier, where James was indicating, so it's our EMR. From here, I'm just going to click on the document tab located at the black navigation bar. From here, once I click in here, it allows me to see all the documents that's available for me to use. For this particular demo, we'll be using the respirology console. So in this case here, you can certainly have a few ways of looking for that actual report. You can scroll down to look for the actual respirology console, or you can certainly go into the search new document section, and I'll start typing in respirology in here, and you'll start seeing again, it's not case sensitive. It started showing up for me, the respirology console. Within here, you'll notice that there are stars located in here that's grayed out. what I'm going to do now is I'd like to favorite this respirology consult. So I would be clicking on this yellow star right now, and it's going to turn yellow. From here, I'm just going to click inside, and you'll now notice that I've now favorited this particular report. So for all of you guys to use this is that if there's a particular report that you're always constantly going to be using, you can certainly favorite it so that way it disappears. You can also click show all if you'd like to see what are other report types that's available for you to use. So right now what I'm going to do is I'm going to be going into the respirology consult. Within the respirology consult, you'll notice in here, this is the title of the actual report that we currently have. Beside that is a little preview button that allows us to view what we have dictated. And then to the right of that, we have a save button, which saves our document and it saves it into draft. And then once we're done with our actual report, we can sign it off. Underneath the respirology consult, you'll see what it says contributor. So this is where your name will be indicated since you are the author. Underneath that, these are the different doc sections that we currently have. We have the history and physical, assessment and plan, procedure, and MDM, which is our medical decision making, which is also considered our scoring tool. So in this case, what I'm going to do is I'm going to start dictating within the history and physical. I'll be using Dragon in here as well. And also, I'm going to be using our quick text within MEDITECH, which is similar to a template that we would be creating within Dragon. So for now, I'm going to be clicking on this section over here. I'm now turning on the actual microphone within my phone right now to use Dragon. I'm now going to start my dictation. My positive pneumonia. Next line. Undo that. Next field. Focal rails. Next field. Demonstrates radiographic abnormalities consistent with an acute pulmonary infiltrate. Go to end. Next line. For this portion, this is the part where I'm talking about a quick text that I'm going to use that I've created within MEDITECH. In this case, I can certainly just type in, instead of me saying my positive pneumonia, I actually created a particular code. In this case, I'm typing in .cap and pressing the spacebar, which then populates that actual template or that macro that I wanted to use within my document. I'm now going to continue on using Dragon again to continue the rest of my report in here. The patient's recent history does not suggest that this is likely Legionella or MRSA pneumonia, period. What you'll notice in here as well is we have some square brackets in here, which are pre-defaulted into the system that I've created. And because I want to keep this one in here and be part of the actual paragraph, I'm now going to say accept default or press the check mark within my microphone in here. And what that does is get rid of the square bracket and it's now part of our actual template. Was there a question before I...
There is, Maria. You have a question. Does it autosave after a set amount of time? What happens if I forget to save and I walk away from the computer?
So there is an autosave. You will notice it's located, it will populate here at the bottom where it will autosave the document for you. And what happens, it becomes like appending onto the document. So if you happen to leave this open still and you walk away, when you come back, it would still be on the same spot. Again, we always say hit the save button in order for it to be, your document not to be lost.
So 2 other questions. Are saved documents seen by other providers, or does it go into the system only when signed?
So the save button, it is seen by the other provider. We do have an actual verbiage on it that says that this is draft. It's now going to be available to be seen, and then you can always go back to it again.
And then is there a blank template instead of ones with pre-populated headings?
So With regards to the template, when you guys get your DMO training, you have the capability of creating any type of document that you would like. So right now, what you're seeing in front of you are different, what we call doc sections, where it's currently empty, where there's nothing in there. So you can actually just click on it and just start dictating, or you can use Dragon as well within here, where you can actually create your own auto text in terms of any type of template that you'd use.
And then you have one more. Once signed, you cannot alter or edit, correct?
Once you have signed it, you can make an addendum to the actual report.
The chat box is clear.
Thank you. So and now what I'm going to do now is I'm going to proceed and click onto my assessment and plan section. Within this particular section, you have the capability of putting in a billing code if you choose to. Other than that, you can also put in a problem. Within this problem is that if you want to state any problem onto your document, you can add them on here as well. And for the purposes of today, I'm just going to type something in here as a billing code. We do have an actual NPR report that is created for the physicians that they can run at the end of their session, so that a billing code will be populated for them for any of the patients that they've entered billing codes for. So the next part now that what I'm going to do is the actual assessment section. Again, in here, what I'm going to do now is I'm going to use straight dictation in here and also a mixture of the macros again. So for this case, I'm going to start again using my phone again to start my dictation. The patient has been treated with IV antibiotics, but given the persistent respiratory symptoms, comma, I feel the pain, select pain, patient will require inpatient management and hospitalization, period. The patient has been placed on oxygen and core measures addressed, period. Next line, my ending. As you noticed in there, I made a mistake on that where I said pain instead of patient. What I've done is I've used Dragon in here and selected that word that I've made a mistake on and corrected it right on the spot. So when you guys will be trained with Dragon, those options and capabilities of moving around the actual document will be trained for you as well during this, once you get your training. I'm now done with my assessment and plan. I'm now going to proceed and show you guys the procedure section. Within the procedure...
Before you jump there, Maria,
yes.
you have a couple of questions. Will this replace our dictation system for consults?
So what I know as of right now is that the phone dictation where you pick up the phone is still available. I'm just not sure to what extent. It's still in progress of discussion with regards to that. But as far as I know, the phone dictation, you can still pick up the phone and do the dictation.
So it's Karen. I can confirm that that will be available at Go Live. Obviously, the intent would be that we will want people to move over to Dragon where possible, but there are some areas that don't currently use MEDITECH as their primary source, so they would stay in what we would call back-end dictation. And then you have one more question, Maria, which would be, why would we put in a billing code?
So again, this is just an option. So there are some physicians that uses an actual printout where they put the sticky note on them, and then they would use that as their little guide of where the people that they would be doing for billing, and then they would bring it to their offices. In this case here, if you choose to use that particular section for the billing code and add a billing code on it, then you can certainly print a report where it's already associated. That billing code will not be seen as part of your actual report.
And it's not mandatory, correct, Maria?
Yes, it's not mandatory.
Okay, and then you have a couple more questions. When notes get done in MEDITECH, what other providers are copied? Example, family doctor, and can we specify this, and does it get auto-faxed to them?
So what's going to end up happening is that within the document itself, anyone who is part of the registration, any provider that's part of the registration will automatically get attached to it. If you wanted to add a CC to it, then you can certainly add on to that one. So in doing that, again, once you've done with your actual documentation, once you hit the sign button, you have the capability of adding other physicians onto this document, and this actually looks into our provider dictionary that has been built within MEDITECH. So if it is a provider that we have within the system, it will automatically get faxed to their offices, depending upon how they are set up on the back end, whether they would receive it electronically or be faxed to their offices. The next question.
So what if a provider is not within the provider dictionary?
So currently right now, that is a process that we are looking into. With some of the current process right now is that there is another person that sends an email to clinical informatics, and then from clinical informatics, they add this particular physician into the provider dictionary. Once it's been added onto the provider dictionary, it then gets resent to those physician that needs to be associated to that particular report. Again, it's still in process, the workflow for it, how it would move forward with regards to Expanse.
So that'll be included in training.
Yes.
And then you have one final question. What about diagrams? Example, physical findings or photos?
Currently, right now, that particular conversation is still in talks, or in terms of trying to what's allowed for us to have within the system itself. Currently, right now, if we send a report through an interface, an image is something that we can't send through an interface. So it's still being discussed and looked at about the possibility for diagrams and images to be associated or added within the report.
Okay, I think the
And did
chat
you
is
see that
clear, Maria.
Maria's
Yeah, it just
document
auto-saved.
Oh, it did. Okay.
Yeah. All right, off to procedures and MDM.
Okay. So in the procedure section, again, this is not something that we're mandatory asking you to fill out. If you choose to use this section, these are discrete data that we are able to pull data for you for a report if you choose to use it. Otherwise, you still could use the actual dictation box within your assessment and plan and actually indicate the procedure within that particular section. So for now, I'm just going to click on the arterial line section in here and just pick a bunch of information here just to show you how it would look like on the output. The next section we have here, it's called MDM. This is called medical decision making. This is our scoring tool. Again, depending on the specialty, we would have some sort of scoring tool that we can certainly put into the report for you if you choose to use it. One of the ones that we have right now as an example, we have the TIMI risk score here. And again, I'm just going to, for demonstration purposes, I'm going to be picking in some data in here. As you can see, it's starting to calculate at the bottom here in terms of all the yeses to calculate the actual score itself in here. There was another question I think that I just saw.
Yeah, so who decides these entries?
So what's going to happen with regards to the scoring tool is that it would be sent out to the physician champions in terms of what are the types of scoring tool that would be needed to be added onto the documentation, and also something where the CMIOs as well.
Yeah. Chat is clear.
Okay, so after I've put in all the data that I currently have indicated here, what I'm going to do now is I'm going to click on our preview, which is located right here. I've now clicked here, and now this is the document. This is exactly how the document is going to be sent out to your physicians, to your family physicians. So as you can see, we have your assessment and plan where I've indicated data. You'll notice that the billing code's not indicated in here, even though we have entered it onto our document. And you have your history and physical, you have your procedures here, and your medical decision making. Now I'm going to click back on a little preview button in here. Just brings us back again to the document, and then we can continue on and do any more documentation that we would like to add. So in this case, I'm all done. I'm now going to go and click onto my sign. Within the sign button, if let's say you have another physician that you'd like to be part of this actual consult, you can add another signer. So under here where it says other, you can certainly click in here and indicate the physician that you would like to have contribute as well onto this particular report. Otherwise, what you can certainly do is you can just go to additional copies to, and you click under other. In this case, I'll find Dr. Lane and add him as the person to receive copies to, and you can see it in here. It's populated for me to pick, and I'll pick his name. He's now added here. Once I'm done, I can now sign off this document. Everyone will be receiving a code, a PIN code that you guys will be using. Again, it's 4 characters and up. I've now signed off the document. Now you'll notice it's now gone from my list here. Within about 5 minutes, it will then be shown within our chart section here under the provider notes. Under the respirology is where it's going to get populated. And that concludes the documentation side of the house. Are there any more questions? Oh, you're muted, Karen.
Of course I am. Just a suggestion from Dr. Kruzik, and we'll consider. We do have a hand up from Richard Thomas.
You may be muted. You may just have to unmute. Dr. Thomas? Or could you kindly put it in the chat?
Yeah, the hand's disappeared. It might have just been a little fleeting hand.
Okay. So if there's no other questions, thank you for taking this time.
Sorry,
Oh.
I found it.
Oh,
There you go.
What about, I work as a hospitalist, and where would the progress notes, daily progress notes be put in this system?
So with the progress notes, I'm just going to do my show all in here. We do have progress notes in here. So for everyone, it will also, once you sign it off, it will be under the provider notes. And then within the provider notes, it would indicate progress note on it. So here's one that's under the general. There's a hospice progress note that was documented.
Thanks.
You're welcome.
Is there a way to view the report as a draft before signing?
So if you ended up hitting it as a draft, so if we go back in here, I'm just going to click in here. Again, I'm just going to type in here right now just the word test. You can click here to actually, so you see the word test on this one here. So that's a way to view it before signing it off. Or you can simply just hit the save button. And what happens is you'll notice it's on here as well as a draft. And then when we go back to the chart, it just takes a few minutes to come back into here. But right now, I'll just show you, this was the one that I just did that I signed off. If I click on here, it shows you the patient, the actual hospital up on top here, and then the patient data, and then everything underneath are the ones that we've actually done our dictation on, who it was dictated by, and then the dictated date and the transcribed date here are located at the bottom. So, and let me just refresh my screen here. Just waiting for that draft to kind of come across. As we're waiting, was there another question?
There sure is. There's a few. Why is the assessment and plan at the start of the note and HP is lower down?
So at the moment, during with the help of the CMIOs, it has been indicated that assessment plan is something that would be easier for physicians to read first and see before the history and physical. Again, all of this can also be adjusted. Just to go back onto the draft, here's the draft that I just created. This is seen by everyone, and like what I mentioned before, there is an actual disclaimer. It says this report is draft. There may be substantive differences between draft and signed reports to help indicate that this is a draft document. And once you have this here, this is another way for you to view it. You close out. If you're ready to go back and finish your documentation on that, you can just certainly click on the document. And then, like what I mentioned, it is up here. And it's also here under the sign queue. Within the sign queue here, it's in here as well, where you can go back and hit edit and then complete your actual dictation.
You have a question, Maria. Can the progress notes be customized to automatically have things like vital signs, temp, etc.?
It can be for yourself. You can use either Dragon to do that, or within MEDITECH, there are something called formatted data where you can pull in data onto your report itself. Again, you will be trained further during your training.
Perfect. One more question. Why aren't medications, etc., in our history report? This is important. And do we rely on nurses' entry of home medications?
So currently, right now, the medications are not part of the document. This was something that was mentioned at the beginning of the report when we were creating them, because they wanted a free text field of people to actually dictate into it. But you can pull those data if that is something that you would like. You can certainly do that as well. Again, it's through a formatted data.
Okay, and I'm going to try to do Dr. Kruzik justice. Some people don't sign until discharge, and then otherwise cannot edit, can only do addendums, is his question.
So are you referring to, you currently have it on, sorry, go ahead.
So I think he's asking, can he leave the sign off until discharge?
Yes, so long as you save the document, it's on your save. So I'm going to save this again. You can have it, and let me just get out of this section in here. It will always remain on here so long as you make sure you go back to that patient, or like where it was earlier, it will always be on your sign queue to remind you that you still have a document that you need to sign off.
Okay. Hoping I captured that, Dr. Kruzik. If not, please restate in the chat. Your chat bar is clear for now, Maria.
Okay, thank you. If that is all, I'll pass on to Erin now, who will be looking after the order set. Once again, thank you, everyone.
Hi, everybody. My name is Erin Gisborne, and I am one of the members of the Physician Systems team, more specifically on the order set team. So on behalf of the order set team, before we get started on the demo, I did just want to say thank you to all the providers that have been our leads over the past year. And we really would like to just thank you again for your communication, commitment, and of course kindness during this year. And now we're really excited to show you the results of all your hard work, and as we move from our building phase and into our testing and finessing phase. So just wanted to say thank you before we get started here. I'm going to turn off my camera while I present to avoid any kind of glitching. And we're going to walk through the ordering screen. So back up here on the black ribbon, I'm in the Orders tab. As soon as you go into the Orders tab, it's going to bring you to the Current Orders tab that's on your patient. So you're going to be able to see here what current orders are on your patient. If we drop down here, you'll also see there is a hold queue, which Rico will go over at the end of my demonstration, and that's where suggested orders will be addressed. And there's also historical. So if I were to click on historical, for testing purposes, this patient's pretty clean, but we would see anything that has been completed or anything that has been discontinued on this patient. You can do a quick review of your orders. The next one I'll bring you to is the Entering Order tab. So it's going to first bring you to your Favorites tab. As soon as you get access to the system, we highly suggest that you start to favorite some of those order sets that you are going to use frequently. So we have different types of order sets in the system now. We have convenient sets, which are like small, quick picks, and then we have admission sets, which you can imagine would be much larger and involved with more orders. So here I have favorited a couple of independent orders. So for example, invasive ventilation, and I can go in and put my settings, or laboratory, I favorited a CBC. But I've also favorited some of my order sets. Anything that you don't find in an order set, you can order outside of an order set independently in the Orders tab. The order sets is just more of a quick convenience way to pull in a lot of orders at once. You can imagine there are thousands upon thousands of independent orders in the system. So our leads have worked very hard to provide content of what would be used for order sets, and we've pulled those in. Another thing we can do in order sets is pre-populate certain fields for you guys, depending on what that population might need, and that has come also from the leads that we've been working with for order sets. So first I want to show you, this is one of my favorites. No, you cannot create your own order sets in the system. The first one I'm going to show you here is a convenience set. So a convenience set, again, is those quick picks. So you can see this, for example, is your analgesics and antipyretics. And this would be used primarily by our medicine colleagues. There are specific sets for surgery, anesthesia, etc., that have their own convenience sets as well. These small convenience sets we're also able to pull into admission sets, which I will show you when I demonstrate the pneumonia order set. And this helps when we're updating. So whether we're updating formulary or we're updating due to best practice guidelines, we're able to make changes at the convenience set order level, and then we're able to push up those updates without doing massive overhauls. So it's nice from a maintenance point of view. When we're looking at medications, we also have to think of now with Expanse, we're also introducing bedside medication verification for nurses and our pharmacy colleagues as well. So we are able to go in and manipulate medication strings as long as they are the same product. If you need to go outside to a different product, you will see multiple different strings, and that comes down to the barcoding. So if we were to go in here into the plain Tylenol here, acetaminophen, you can see that we've already have a pre-populated 500 to 1,000 milligrams PO Q6 PRN. But if I go and I click on this, it goes green. Anything green you can manipulate in the system. So if I want to go in here and I want to say, actually, I don't want to give that dosing range, and I'm just going to give the patient 500. I'm going to go PO, and I'm going to change that to, QID instead. And I'm going to actually make it scheduled. So I actually went and changed that whole string. But again, that convenience set's there so you don't have to go outside and look for the individual Tylenol order. Again, I can go back and put it, if I wanted to do the range, I can go in and put it back on. And we're going to go Q6 again, and I'm going to change this to PRN, and for right now, I'm just going to say test. You can see under here, though, for the rectal dose, it would be a different product, so that's why you're going to have a different Tylenol string there. And it's the same with ibuprofen, ketorolac, etc. Anytime there's a green eye here, it just means we have label comments. So the label comments, for example, would be the maximum 4,000, and that would go over to the nurse's EMR that they could actually see that as well. There's a yellow alert space here, so if I go on and click on that, it's just going to tell me that I'm trying to order ibuprofen, but just a reminder that this patient is diabetic, so there is a warning here. You can drop down and get a little bit more information if you want some information. And again, you can override conflicts, but that is there for you. And anytime you see kind of like sentences in here, we call them reminders within the order sets. So for example, use NSAIDs with caution in elderly patients and those at increased risk of fluid overload, renal impairment, or GI bleeding. This is only seen at the point of order sets. So this would not go anywhere else in the system. It only lives on the set itself. So that would be an example. This would be an example of a convenience set. Do I need to override every time yellow triangle, every time I use the order? No, this is just something that will show you if you click on it. So if you wanted to see why it's giving you that warning, you can go into it. So that's the example of a convenience set. If I go into a admission set. So again, I have favorited the pneumonia admission set here, so it's nice and easy in my favorites. But if I had to go look for it, I can go into the sets tab, and you'll get like the full list here of the sets, and you can search it by pneumonia. We're also able to program in aliases that can pull things up for you guys as well. So you've got pneumonia sets, but I'm also able to divide it by specialty. So I can go in and look at my own specialties. And we are cleaning this up right now just to ensure that it matches the specialties on our products as well. But if I were to go down to internal medicine, I can see what would be most frequently used there, etc. So there's a bunch of different ways to find the order sets. If I go into my pneumonia admission set, you're going to see here that, again, I have this reminder section that won't go anywhere, and it's just for you guys at the point of order entry. I'm going to go into my admission. So this is going to be your actual bed request. So this is how you would submit your bed request, medicine, and if I wanted a higher of care like ICU, etc., I could click on that as well. Additional precautions is going to be your infection control. So be able to put on your droplet contact, etc. And again, we're able to put these types of orders into the sets where it may apply. It's not going to be on every admission set. The additional precautions piece, your admit order will be there, but your additional precautions will only be there if it's applicable to that set. We talked about the, go ahead. Karen, did you?
Yep, you have a question. Yep. How do you know what has an order set and what needs to be done individually?
So at the end of our approval process, we will be sending out the order set list to the department chiefs that will be able to share that so that you guys will have that for your training. And we will, during your training, it'll also go, you'll be able to play around with some of the sets that are applicable to you.
And you can also search the sets by specialty, correct?
Yep.
Yep.
Yeah. So then you have your resuscitation status. So James had mentioned this briefly in his presentation, showing you that over here, your resuscitation status is going to show. Your resuscitation status, we are standardizing across the 4 sites, so you will get more training on the specifics of this in your training, but you will have to pick your code status, so full, limited, or no. If you click on limited, there are some additional fields you will have to require. So what will the patient want to include in their limited resuscitation? So let's say we'll do, not chest compressions, let's say we'll do, take electric. Resuscitation decision obtained from, so who did you obtain it from? We'll say capable patient, and that removes the SDM. But there is an option, of course, that you can update this. So in the event of an emergency or anything like that, you can always go and update your order. For diet, so again, the CARE4 collaboration, we're going to go live with a standardized diet protocol. So a protocol, what a protocol is in the system now is specific actions and instructions that we want to give to nursing staff that may require a bunch of different orders that would result in more clicks for you guys and more information on their work list. So we're able to put it all together into a protocol. So a protocol is still your order. So that's why you still want to know what the content of that protocol is. So your protocol order, you're able to pull it up on a P and you'll be able to see exactly what the nurse will be getting. The diet protocol, again, will be reviewed in your training since we are standardizing it. But this is the instruction that will be doing that. If you wanted to order outside of the protocol, you simply would not order it, and you can go ahead and order an independent diet. I will explain that when you do order certain diets, you will have to put in more information. So you will have to pick things like textures, etc. So that's why you will have a protocol diet, the diet protocol here. And if you wanted an additional diet that might be relevant to your patient, so for example, some of our surgery sets will have the ERAS and a couple more diet options here that they can choose from. But for medicine, it would most likely be the protocol or an MBO diet at this time. Activity restriction. So we are going live with standards of care. So activity as tolerated is a standard of care. We don't need that. Vital signs routine, we do not need that. So anything outside of that, we can do this. So we do have activity restrictions, another module we can put in here. Respiratory, so if we were to go into like respiratory and pick on for oxygen and want to do our SATs, so it does have a drop down where we can go ahead and select the SATs targets we want. Or we can just override it and say, actually, you know, I want them to go to 90 would be their target, and you can always override that. When we are picking IVs, again, we can always ask them to insert. If you do ask them to insert the IV, there are a couple more options that, again, we can pre-program at the order set level, or you can override what was in here. So if we said reinsert, yes, make sure one is there, and yes, we can remove. Boluses. So when it comes to IVs, there's always going to be a predetermined number here for you. But a reminder, anytime you see a numerical value, you can go in and change that. So that's something just to keep in mind as well. So the bolus might not be that influential, but if you see down here on the maintenance therapy, it's going to start at 30, but we're actually, want to go 100, and then we'll be able to change that. Medications. So, and this will be the standard template for order sets for like anybody that's an inpatient. For our ED order sets, they are slightly different in regarding the order, but this is the general order you will get. You'll have medications. You can see here that we pulled in a couple of those convenient sets, but we've kept them collapsed so that you're able to go in and pick what you want to see. So if you think that this pneumonia is caused by community-acquired pneumonia, you'll be able to open that up and pick the appropriate antibiotic. Again, anytime you see an I, will be some instructions that will go to the nurse's EMR. So additional coverage, this is all this. And if I didn't want this, I can always uncollapse it as well. Go through. Something like hypoglycemia also comes with a protocol, but this protocol is slightly different because it involves medications. So if you pay close attention to right in this section here, if I were to click protocol, what it's going to do is it's going to now reflex those medication orders that are related to that protocol. So you don't have to go and look for those medications because it's a part of the protocol you're ordering and it's going to reflex it for you. Again, you want to make sure that you are seeing what you are ordering. There's a P there. I can pull it up and see what I'm asking the nurse to do. This will be available on the nurse's work list. This will also be available on the nurse's MAR, and when the nurse scans a medication that's related to a protocol, the protocol will pop up on their screen. So they will see the protocol in multiple ways. When I go down to lab, so panels have been standardized across the 4 sites as well. So for right now, what we have done is anytime there's a panel, we have kind of put that note above to say what the panel includes throughout your training and until you guys get used to what's in there. Again, you will have some reminders up here. And anytime you see an external link here, globe, that's going to be an external link. So you can see this is a reminder from Choosing Wisely. And if I click on this, it's going to take me right to the Choosing Wisely website and where we got that reminder from. So we're able to do that with different best practice guidelines, etc. For lab, what we have done is we have defaulted the urgency of the lab work dependent on the area that you're ordering from in the order set. This will be something that, again, will be go over on your for your training. And this has been kind of determined by our lab team in regards to either collection or processing. But again, you're able to go in and change that. So if you said, actually, you know what, I need that CBC urgently, you can go in and change it to urgent. Okay. If you wanted to do something where you said, hey, I want a CBC and I actually want it, 3 days from now, you would be able to click on the date and you'd say, actually, I don't want it to start now. I want it to start, on Monday at 6 a.m. So you are able, again, to manipulate that. And if I go, is there another question, Karen? Sorry.
Yeah, so we have a question that says, how does it work if you are the person using the order as well as the person administering the orders? So I feel like they're asking if I'm the same person placing the orders and administering the orders. Is that correct, Lynn Marie?
I would say that would go off current state, like how we would do it current state.
The other way that we could do it is when we get into the edit MAR section, you can actually say that the medication was given by the MD, and that we can show that later in training.
Yep.
Medical imaging is going to be the same as lab. So again, the frequencies will be defaulted based off of the location you're in, and consult. So this was a question that came up and Maria said we would show you a little bit. So consults, you will only see imaging, consults, and lab work and medications that are related to your facility. So you won't see something that you are unable to order at your facility. Right now I'm in the RVH environment, so that's why I'm able to see infectious diseases, respirology, etc. So if I were to go in and I wanted to collect, actually I want to consult with infectious disease, I'm able to either pick the provider, like so I can say the provider and I can say, you know, who I've had that conversation with, or I'm able to pick provider group. So again, I can say, actually, I just want to, you know, refer them to ever and put them in here. You always want to make sure that you're doing your reason for consultation. So, I don't know, pneumonia. And then has the provider been notified? Yes or no? I'm going to say yes, I've had the one-on-one. We're also finessing this, launching the on-call schedule. So you're able to launch from there to see who's on call from your colleagues. So when you do have to do that one-to-one phone conversation, it will launch you into your site's on-call schedule. So you'll be able to see that. Right. And then you see down here, there's suggested order sets. So suggested order sets are some order sets that our leads have said, you know, we might need some of this for our pneumonia patients, but maybe not all of our pneumonia patients. So we would like them to be easily available, but they don't need to be embedded into the admission set. So that's why they're there. And again, you can easily click on and say, actually, you know, I want to order the bowel management, and I can open it up and just, again, continue on my way through the order set. Is there any other questions or anything right now?
There is just a chat going on in the chat box around consultation. Yes, Dr. Kruzek, a conversation is always expected with a consultation.
You want me to explain on that one a bit further, Karen?
Sure, go ahead.
Yeah, so if you order the consult in the system, it actually fires to the other physician directly within their system. So if Aaron were, just to highlight that workload button at the very top right hand, a number would actually appear in there, or a consult would appear there, and you would be able to see that directly in the system. And actually, the ordering of a consult also populates the My Consultation list in the home screen. That will be covered in training as well, though.
Okay. Anything else for order sets specifically?
No.
Okay. I will hand it over now to Rico to show you how suggested orders and the hold queue will work briefly.
Thanks, Aaron. Hi, everyone. My name is Rico. I am also a consultant with Health Tech, and I'm mostly working with the ordering team. So a little bit in the different areas, so ancillary departments such as DI or laboratory, as well as the nursing orders. So what I'll quickly show here is, let's say if I was a consultant, not necessarily the consultant who would be admitting a patient from the ED, but let's say if you have an admitted patient that has been, you might have required or requested a consult for, let's say, neurology or cardiology for your patient. So as the consultant, just like any other physician, I would be able to go in the chart, review the information. As Jane mentioned, you would have also received a notification in the workload section telling you, hey, you have a consult in there. So essentially, once I was finished reviewing the chart, assessing the patient, and let's say I would have orders that I would like to suggest to the MRP. So when you do access the orders section here, one thing that you will notice, essentially, you can go to your current orders. You can also enter orders. But when I click here, I'll have an option called the hold queue. This functionality essentially allows you to place orders in, you can almost say it's a bucket, if you will, of orders that are designed to be activated at a future time or a future date. So essentially, any orders placed in here will not become active orders on the spot, which is very different, obviously, than putting a brand new order on this patient, which would get triggered and would go to the proper ancillary department or to the nurse taking of the patient. So what I'll do here is I'll click on the hold queue. And then what I would do, I would simply create a new event. So here, it allows me to create my bucket, if you will. So I can say here, as soon as I open here, I've got this drop-down list that will open automatically. And I can say here, I want to put suggested order from one physician to another. Okay. This field is also editable in free text. So I could go in there and I could say, you know, suggested physician to physician. And I could, you know, if I wanted to, I could say cardio. And then the facility here, you would determine, you would select the facility where the patient is. And then let's say here, usually if you do not free text in or you don't edit it, this would default to today automatically. But as a shortcut, I can simply put a T in there, and that will also take today's data automatically. So what I'll do next is, once this is done, I will click on Add New. And here you'll see again, I will have access to my favorites fairly easily. And I can also go in and you could either suggest some orders in an order set, or you could take individual orders. So let's say as a cardiologist, I'd like to suggest metoprolol. Whoops. There we go. So here I'll take 100 milligram PO daily. And once I'm done this, I can simply go in and submit this. And again, here before saving, I'll get a summary telling me the orders I'm putting in there. And it's also saying here that the start date is upon activate. So essentially this means, again, it will not become an order automatically on the spot without giving the MRP a chance to go and review. So the next, as I come in to see my patients, you'll see, and I'm not sure if you noticed, but as soon as I clicked out of that patient's chart, the whole queue indicator here became available. So the first thing is that obviously you would have a consultant note waiting for you to be reviewed once they were done documenting. And then you, this is your kind of visual cue to let you know that you have orders in that hold queue. So once I click on this, it will give me a few options. So it's going to ask me, do you want to go and open your chart? Do you want to go to your current orders, or would you like to go see what is in the hold queue? And essentially, what I'll do here, I'll click on the hold queue because I would like to see what the person or my consultant suggested. So here I can see I have suggested orders from the cardio, and then I can simply click on here to see what is suggested. And if I agree with it, I can simply go here and activate, and it will become an order automatically. If, let's say, I would not agree with it, or I would like to modify it, you could click on edit, or you could simply delete the whole thing altogether if you do not want to go forward with any of those recommendations. So if I click here on activate, it's going to go here automatically. It's telling me it's activated. It cannot be activated twice. And then if I go back to my current orders, I can see now that this medication is now ordered. In the event where the physician, or in the event where I would not be around when these suggestions were placed in, or it wasn't necessarily in the system, the nurses would also get an indicator on their side to let them know that there are some orders in the hold queue, and they can assess the priority or the urgency of acting on those orders and those suggestions. Do we have any questions that we could talk about? I see a few things popped out when I turned around for a second.
I think there's just some chat around medical legally, around consults and the entering of that. So we acknowledge your feedback, and we will take it back and have some discussions with the CMEOs at the Physician Advisory Committee to see if we can smooth that out.
CBC Daily ×3, there you go.
How do we enter this?
Let's do it. So I believe, there you go. I have CBC here in my favorite, it turns out. So here, what I decided to favorite, the routine I wanted to favorite was routine. However, it's not necessarily what I want. So I have two options. I could simply click here on the drop down to see, oops, I'm sorry. It's because I put it in my favorites. Let me just type in here, CBC, because I only put one order as my favorite. I didn't put one direction. I didn't put the whole order. So when I click here, for this patient, its location as an admitted patient, as soon as I clicked on the order, routine became available. However, if I wanted something daily ×3, I can simply click on daily right here. And you can see that the first lab that will be collected would be tomorrow morning at 6 a.m. So this is the default collection batch for routine labs. If I wanted to have it daily, right now it's the limit is 1. And I could simply click in here and put in 3. So this would essentially trigger CBCs for 3 mornings in a row. So you can see here that it starts tomorrow morning and it will end 3 days later. So the 26th, 27th, and 28th. So that would be what I would need to do. And all I would have to do is click on submit and save this order.
We have a question. If the nurses call us about whole queue orders, can they take a verbal order to activate, or do I have to stop what I'm doing and do it myself? Nurses can still take verbal orders in the electronic system. The expectation would be that if you can place the order yourself, that you would, but if it's unreasonable to do so, you're in the OR, you're driving, you don't have access remotely, any of those kinds of things, that obviously they would take that verbal order to continue with patient care.
Now, another question about Q2 days. So yeah, thank you, Heather. So essentially, yeah, if anything, I would want to have Q2 days. I could here, again, here I can say I want it daily, but instead of daily, I could click in here, and we will obviously provide these directions when the training is given, but I can simply type in here Q2, sorry, not Q2 hours, Q2 days. There you go. And then I could say, you know what, I want it for 3 times. So you're going to see now oh, I'm sorry, I didn't press enter. There you go. So now it will calculate to have okay. So yeah, you could have it Q2 days. So I'll just put 2 for now. But yeah, so you could schedule them to have them every 2 days.
That will absolutely function. What I would like to remind everybody is we are showing you stuff in a test system. So if we're building on stuff or we're still changing things in the background, sometimes it doesn't work as smoothly as what we would like in demonstration, but obviously those bugs will be worked out for live. And I think you have a clear chat box right now. So that brings us to the end of our formal presentation. Last opportunity to sort of put in any questions. Throw up a hand, shout out anything. Okay, so I'm going to share my screen. Oh, thank you, Michael. And I'm just going to hand over to Dr. Lane to walk us through to the next portion of our evening.
That's great, Karen. Thank you. And a real big shout out to all of the clinical team members for an excellent demonstration today. And also a shout out to MEDITECH staff who were on the call. We really appreciate your support. Just look out in future for training dates. As we mentioned, the online training will be available at the end of May, and a sign-up process for in-person training at each of the sites will be coming out at the beginning of April. If you go to the next slide. This is the conclusion of the general session. The next hour will be for the champions and clinical leads. I believe the 3 sections will be placed into the chat for you to be able to click into.
Yep.
I also believe that those sections are available in the invites that were received for the session itself. So as a wrap-up, I really appreciate the involvement, the excellent interaction that we've had through the chat today. And I hope this is just a taste to encourage you to become involved and much more knowledgeable about MEDITECH. It has some very powerful tools built into it that I know all of the CMOs are excited to institute in our hospitals. Thank you very much.
Thank you, James. Thank you, everyone. Just a note, if your specialty is not listed, so, you know, internal medicine, anything along those lines, the hospital's medicine flows will be the closest mirror to what that looks like for you. So you will jump over to there. I will stay on the call to direct anybody that can't find the links. I'm happy to do so.